Impact of tobacco smoking on lung diseases according to WHO standards. Hello everyone. Smoking is often considered a personal habit, but in reality, it is one of the most serious risk factors for lung health and the entire respiratory system. The damage caused by tobacco smoke does not appear suddenly, but silently accumulates over years, cigarette by cigarette, causing many people to discover disease only when lung function has already declined irreversibly. The danger lies in the fact that early manifestations such as mild cough, morning sputum production, or shortness of breath during exertion are often considered normal and easily ignored. In this video, we will comprehensively analyze the relationship between smoking and lung health risks based on official recommendations from the World Health Organization and health agencies of the United States. The final part of the video will summarize key points that viewers should absolutely not miss. Before moving into the main content, we invite you to subscribe and enable notifications for the MMM channel with the YouTube handle @MMM. And now, let us examine the detailed content. First, smoking is the leading cause of structural lung damage and irreversible decline in respiratory function. According to the World Health Organization, tobacco smoke contains more than 7,000 different chemical substances, including dozens that have been proven to cause cancer and hundreds that are directly toxic to lung tissue. When a person inhales tobacco smoke into the lungs, ultrafine particles and toxic gases rapidly penetrate deep into the alveoli, which are responsible for gas exchange. At this location, these toxic substances cause strong irritation, damage the epithelial lining of the airways, and destroy the natural elastic structure of the lungs. The lungs normally have a self-cleaning ability through the ciliary system, but tobacco smoke paralyzes this system after only a short period of exposure, causing mucus, bacteria, and dust to accumulate increasingly. This accumulation is the initial foundation for the development of many chronic lung diseases. Second, smoking directly causes chronic obstructive lung disease, one of the leading causes of death worldwide. The World Health Organization identifies chronic obstructive lung disease as the fourth leading cause of death globally, with approximately 3.5 million deaths each year. Among these, more than 70% of cases in developed countries are directly caused by long-term smoking. The disease mechanism begins with chronic airway inflammation induced by tobacco smoke. Over time, the bronchial walls thicken, the airway lumen narrows, while alveoli are destroyed and lose elasticity. The consequence is that air can enter with difficulty and exit with even greater difficulty, leaving patients in a constant state of oxygen deprivation. This explains why patients frequently experience shortness of breath, especially during physical exertion, along with persistent cough and chronic sputum production. More concerning is that this damage is irreversible, meaning, once it has developed, the lungs cannot be restored to their original normal state. Third, smoking is the primary cause of lung cancer and many other respiratory tract cancers. According to data from the World Health Organization, lung cancer is the deadliest cancer globally, with approximately 1.8 million deaths each year. Health agencies of the United States indicate that nearly 90% of lung cancer deaths are directly related to smoking. The cause lies in the fact that tobacco smoke contains many gen-mutating substances which, when entering the lungs, damage the genetic material of cells. These damaged cells lose control over division, leading to the formation of malignant tumors. Smoking-related lung cancer is particularly dangerous because it often progresses silently for a long time without obvious symptoms. When patients develop signs such as coughing up blood, chest pain, or rapid weight loss, the disease is often already in an advanced stage, significantly reducing the chance of successful treatment. Fourth, tobacco smoke weakens the immune system of the lungs, making the body more susceptible to respiratory infections. The lungs are not only respiratory organs but also play an important role in the immune system. Immune cells in the lungs are responsible for destroying bacteria and viruses entering through the airways. However, tobacco smoke reduces the activity of these cells and damages the natural protective barrier of the respiratory mucosa. Medical studies in the United States show that smokers have a risk of pneumonia 2 to 3 times higher than non-smokers. Recovery time after infection in smokers is also longer, and the risk of severe complications is higher. This explains why smokers frequently experience recurrent bronchitis and prolonged respiratory infections. Fifth, smoking damages the lungs through mechanisms of systemic inflammation and oxygen imbalance in the blood. Tobacco smoke contains carbon monoxide, a gas that binds to hemoglobin far more strongly than oxygen. When carbon monoxide occupies the binding sites of oxygen in the blood, the amount of oxygen delivered to tissues, including lung tissue, is significantly reduced. This chronic oxygen deficiency forces the body to function in a constant compensatory state, increasing heart rate, respiratory rate, and the burden on both the lungs and the heart. Over time, widespread inflammation throughout the body destroys lung tissue, promotes fibrosis, and severely reduces gas exchange capacity. Sixth, smoking not only affects smokers but also causes serious lung disease in people exposed to secondhand smoke. The World Health Organization affirms that there is no safe level of exposure to secondhand smoke. Secondhand smoke contains many of the same toxic substances as smoke inhaled directly by smokers. Children living in environments with tobacco smoke have a high risk of developing asthma, pneumonia, and reduced lung function in adulthood. In adults, long-term exposure to secondhand smoke increases the risk of lung cancer and chronic lung disease, even if they have never smoked themselves. This is why global health organizations emphasize the importance of smoke-free living environments. Seventh, there is no safe level of smoking for lung health. Epidemiological studies in the United States show that even individuals who smoke very little, only 1 cigarette per day, still have a significantly higher risk of premature death and lung disease compared to non-smokers. This demonstrates that lung damage does not depend solely on the number of cigarettes smoked per day, but on whether the lungs are exposed to tobacco smoke at all. Each exposure causes microscopic damage, and these damages accumulate over time. Eighth, the long-term consequences of smoking on the lungs are reduced quality of life and increased premature mortality. Health agencies of the United States estimate that smokers have an average life expectancy approximately 10 years shorter than non-smokers. Most of this reduction in lifespan is directly related to chronic lung diseases and lung cancer. In addition to mortality risk, smokers face persistent shortness of breath, reduced physical capacity, dependence on medications, and long-term medical care, creating a significant burden for families and society. Ninth, prevention of tobacco-related lung damage according to recommendations of the World Health Organization focuses on quitting smoking as early as possible. The World Health Organization states that quitting smoking provides clear benefits for lung health at all ages. After 1 year of smoking cessation, lung function begins to improve and the risk of heart disease declines sharply. After many years, the risk of lung cancer is also significantly reduced compared to those who continue smoking. Smoking cessation programs that combine medical counseling, psychological support, and tobacco control policies are considered the most effective solutions for protecting lung health at the community level. Overall, the damage caused by smoking to the lungs is not a random consequence but the result of a long-term cumulative process that is predictable. Each cigarette leaves a biological imprint on the airways, gradually weakening the body's self-protective capacity. International health organizations unanimously agree that most smoking-related lung diseases are entirely preventable if timely action is taken. Proper risk awareness, proactive smoking cessation, and the creation of smoke-free environments not only protect individuals but also safeguard families and communities. If you find this content useful, please subscribe and enable notifications for the MMM channel with the handle @MMM. On these two channels, we will continue sharing in-depth knowledge on lung protection and prevention of non-communicable diseases. Thank you for watching the entire video.